afternoon. Welcome to this launch event of the new WHO Europe and OECD joint report on Step Up, tackling the burden of insufficient physical inactivity in Europe. Today, I have with me in the studio Mr. Ulrich Kunsten, who is the Deputy Secretary General of OECD, joining us from Copenhagen for this launch event. First, we are going to have some opening welcome remarks from both WHO Europe and OECD. And our regional director, Dr. Hans Kluge, is currently on a mission in Ukraine, so he can't join us live, but we have a recorded video message from our regional director.
Dear Deputy Secretary General Knudsen, Commissioner Gabriel, colleagues and friends, thank you for joining the launch of Step Up today. This report makes the clear economic case for promoting physical activity, drawing on the evidence from the 27 European Union member states. My sincere thanks to OECD for their collaboration with WHO Europe on this initiative, and to the European Commission for their support. I am so sorry that I'm unable to be with you in person. I really wanted so, but I'm in the midst of my fourth mission to the field in Ukraine since the devastating war started a year ago. We know that all forms of physical movement are important, and every move counts. Regular physical activity prevents a range of non-communicable diseases, improves cognitive functioning and sleep quality, decreases the risk of falls, and reduces the symptoms of depression and anxiety. I myself, being based in Copenhagen in Denmark, the seat of the WHO Regional Office for Europe, I'm biking like a real Dane every day. The report launched today provides evidence that investing in physical activity policies not only improves individual well-being and population health, but also pays economic dividends. Every €1 invested in physical activity generates a return of €1.7 in economic benefits. Unfortunately, the COVID-19 pandemic delivered an unexpected blow to initiatives promoting physical activity. More than half of European adults have reported that they have been less physically active over this time. But now we have good data, very good data, on what could be achieved if everyone in Europe was sufficiently physically active and met the WHO recommendations. Enabling people to thrive in healthy communities, promoting their health and well-being, is one of the core priorities of the European Programme of Work, EPW. And this year, as we mark the 15th anniversary of the Tallinn Charter, which was all about health for wealth, we are calling on countries to renew their commitment to investing in health systems for better health and wealth. But we also need to better communicate the benefits of being active. Again, not just the physical benefits, but the benefits to mental health, huge challenge. Benefits to the environment and the society at large in Europe and Central Asia. And we need to make sure that our systems can and will sustain these changes, a real long-term transformation. We are all familiar with the saying by the ancient Chinese philosopher Lao Tzu, quote, "The journey of 1,000 miles begins with one step," unquote. With this report in hand, we are making progress on this journey together. Let's start with the one step. Thank you.
Thank you to our regional director for that message while he's on mission in Ukraine for the support. As I mentioned, this is a joint report with the OECD and WHO. So it's a great pleasure, Mr. Ulrich, to have you here, our Deputy Secretary General from OECD. Floor is yours for opening remarks.
Thank you so much, moderator. Thank you, Kremlin. Dear colleagues and experts, thank you so much for joining us here live in Copenhagen for this launch of the OECD WHO report on the burden of insufficient physical activity. Before going to the topic of today's discussion, and as Dr. Kluge was joining us from Ukraine today, I'll take this opportunity to offer my solidarity to the people of Ukraine and to condemn Russia's war of aggression against Ukraine in the strongest possible terms. And I'd also like to thank the WHO for the absolutely excellent collaboration on this project. Now, the scientific evidence is quite clear. An active lifestyle can prevent many diseases: coronary heart disease, stroke, diabetes, cancer and hypertension. It also offers protection against severe outcomes from COVID. But physical activity actually does more than stave off disease. It improves cognitive performance and sleep quality. It prevents falls, it relieves stress, and it strengthens mental health as well. Even just 2.5 hours of brisk walking or cycling each week can help prevent disease and increase life expectancy. Anyone who's experienced that relaxed post-run feeling can attest to the positive impact or not least mental impact of movement. And yet, Europeans just don't move enough. Our report finds that 1 in 3 adults do not meet the WHO guidelines on physical activity, and perhaps even more worrying, half never exercise or play sports. So the health benefits alone justify investments in policies that increase physical activity in the population. But there is more than that. Increasing physical activity also saves healthcare costs. Our analysis shows that meeting the physical activity guidelines would save the European Union nearly 8 billion euro per year in healthcare expenditure. That's equivalent of the total annual healthcare expenditure of Luxembourg and Lithuania combined. In addition, increasing physical activity would reduce pressure on already stretched health systems, making them more resilient to future pandemics and other shocks. So the case for investment, as I said, is very, very clear. But what can be done then? Changing behaviors is never easy, we all know that. To get people moving, we need to increase awareness of the importance of physical activity. We need to inform people of the how, the when, and the what, and the where. And we need to improve access to facilities and incorporate movement into everyday life. The good news is that we see a wide range of policies and interventions and initiatives across the EU. Let me just name a few. In Bulgaria, the Cheer Up program teaches workers exercises that can be done in the office and at home. And Croatia is developing trails and parks across the country to encourage physical activity. I visited Croatia last summer. I had the opportunity to benefit from that myself. And here in Denmark, the Get to Sport program from the Ministry of Immigration and Integration funds and supports local sports clubs in underprivileged areas. With today's panel, we will discuss the state of physical activity in the EU and its impact on health and the economy. And while there might be worrying figures, the overall message should be one of optimism. In a minute, we'll hear the concrete recommendations of a report on how to increase physical activity. Now, I join Mr. Kluge in saying that the next step is transforming theory into action in the truest sense of the word action. Thank you very much.
Thank you, Deputy Secretary General, for those very warm opening remarks. So you heard from both OECD and WHO Europe welcoming words for this launch event. That concludes our opening session. And when we are back, I will have the policy analysis from OECD joining with me to take you through some of the key findings of this report.
An effort that can be told without saying anything. Fun that gives you strength despite fatigue. A game where gestures say it all.
Będziesz jutro? Czy będziesz zawтра? Tak.
Sport is our language. The creation of the several hundred new groups in the School Sports Club program support the integration of Polish and Ukrainian children, World Health Organization and the Institute of Sport.
Welcome back. Now I have my colleague from OECD, Sabine Falk, who was a policy analyst who was working on this report quite a lot, joining me. During this session, we will try to take you through some of the key findings of this report. Now, before we go to the key findings, why did we do this report and why did we produce this report? That's because in the WHO European region, non-communicable diseases account for about 90% of the disease burden and deaths, 90%. And these diseases are cardiovascular disease, diabetes, cancer, and chronic lung diseases. What are the key risk factors contribute to them? That include physical inactivity, unhealthy diet, tobacco, alcohol. Physical inactivity and unhealthy diet contributes to obesity, which is the leading cause of disability or ill health in our region. Therefore, it's clear that if we want to improve health, if we want to improve the quality of life and life expectancy, improving physical activity is very important. And that's why we put the focus on implementing policies to support increasing physical activity. But we have seen many challenges to get the support from different stakeholders to implement those policies. An economic argument is often a good argument to bring these stakeholders to the table and to show the benefits or the return on investment for these policies. In most of the EU countries, we had different studies following different methods. Therefore, we didn't have comparable estimates. That's why together with the European Commission's DG ARC Sports Unit and WHO Europe approach OECD and discuss how can we produce a report to provide some comparable estimates for EU countries to understand the burden of insufficient physical activity. Now, taking about WHO's work to promote physical activity, we have the Global Action Plan and we have the WHO European Physical Activity Strategy. And they talk about different policies and multi-sectoral actions we can take to promote physical activity. And those are available on our website, but we need to find ways to implement them. And we hope this report will be one of those tools which supports us to implement those recommendations in our European Action Plan and the Global Action Plan. WHO launched the Global Status Report on Physical Activity this year, which shows in different regions the level of physical inactivity. More than a quarter of global adult population do not meet physical activity recommendations. And also that report shows women do less physical activity than men, but also as we go up in age groups, older population groups do less physical activity. We have a lot of evidence the benefit of physical activity for all the age groups in aging, but we see that the reduced level of activity in all the age groups, which make us a good case to focus on these age groups and more activity. Also, we've seen the European data recently, where since 2017, the level of physical activity in Europe has been pretty much stagnant. And we think during the COVID pandemic, more people found difficult to continue their physical activity levels or reduce. And this may have contributed that in 2022, we see the same amount of physical activity as we saw in 2017 in Europe. This makes the case why we need to develop more partnerships, work together to promote physical activity. And as I mentioned, we hope these reports that we produce with OECD will be one step. And we thank sports units of the DG ARC in European Commission for this collaboration. And Sabine, please tell us some of the key messages from the report. Over to you.
Thank you, Kremlin. So I don't think anyone will be surprised to hear that the report finds that physical activity is a very good idea. We've already heard a little bit about the benefits in terms of disease prevention and physical and mental well-being. But we also find that Europeans don't move enough. As we've already heard, more than 1 in 3 adults in the EU do not meet the physical activity guidelines. And while there is some variation across countries, all European countries have a significant burden of physical inactivity. We also find that it's worse among women, with some countries having almost half of all adult women not meeting the WHO recommended guidelines on physical activity. So what are these guidelines? The WHO recommend that we do 150 minutes of moderate intensity physical activity or 75 minutes of vigorous intensity physical activity. This could be a half-hour run twice a week, running about 10 kilometers per hour. But it doesn't need to be formal exercise. It can also be walking the dog every day for half an hour or mowing the lawn for an hour and a half. And just meeting these minimum guidelines has a significant impact on population health in the EU. So if everyone who is currently insufficiently active were to meet these minimum requirements, we would be able to prevent 4 million cases of cardiovascular disease, 3.5 million cases of depression, and nearly 1 million cases of type 2 diabetes by 2050. We would also prevent 10,000 premature deaths every year, and these are deaths in people aged 30 to 70. These also have an impact on life expectancy. So what we see is that if people who are currently insufficiently active increase their physical activity to meet the WHO minimum guidelines, they would increase their life expectancy by more than half a year on average, by 7.5 months. And this actually translates to a change in life expectancy on the population level, with overall life expectancy increasing by 2 months. Importantly, physical activity will also make us more resilient to COVID-19 and any future potential outbreaks, as the evidence has shown that physical activity reduces the risk of severe COVID-19 outcomes, and it also increases the potency of vaccination. It can also help address the significant mental health burden that the pandemic has had, since physical activity can help relieve depressive symptoms and anxiety, and participation in sports can provide important social connections after a period of social distancing. But there isn't just an impact on population health. Increasing physical activity will also save healthcare expenditure, thereby reducing pressure on already stretched healthcare systems. So our analysis shows that larger countries, such as Germany, France, and Italy, can save more than €1 billion every year if everyone were to meet the physical activity guidelines. And across the EU, the total would be €8 billion every year in healthcare expenditure that we could save if everyone meets just the minimum recommended guidelines. So there's a very clear case for investing in physical activity. And what we found is that policies on physical activity are a very good investment. Previous OECD modeling work has shown that for every €1 invested in a policy package on physical activity, 1.7 euros are returned in economic benefits. So investing in physical activity really is a win-win-win for the individuals, for healthcare systems, and for the economy.
Thank you, Sabine. And that's Sabine Faulk from the OECD, policy analysts who work on this report. Thank you very much for that, and we really hope that these findings will be useful for our colleagues who are working on physical activity to convince the other stakeholders to invest in physical activity. With that, those are the key messages, and when we are back, I will have a panel of colleagues from OECD and few universities to discuss about the findings and how these findings can be useful for their work. Thank you,
Being
Sabine.
physically active improves our quality of life and helps us live longer.
HEPA is a networking organization of WHO Europe interested in physical activity promotion. We're made up of researchers, practitioners, and policymakers from 30 European countries with over 200 members. Our aim is to try to connect people so that we make sure that the researchers ask the right questions, the policymakers understand the research, and the practitioners help us to deliver for improving physical activity and improving lives.
Policymakers and physical activity researchers, they can learn a lot from each other. For example, policymakers can direct the researchers towards the issues in society that really needs an answer.
And here, HEPA Europe, with the help of WHO Europe, is an ideal platform that allows us to share our scientific findings and communicate it to there where then in the end the decisions are being made. It's an ideal platform to come together and think about advocacy for change in Europe.
The HEPA conference is really the cornerstone of the HEPA Europe network. It's our chance to come together as a community, researchers, practitioners, policymakers, and share our work, share our insights into what works to promote physical activity for health.
We must ensure that research and policy come together to ensure that physical activity is ingrained as part of daily life, like I am doing, biking every day to and from the office. Collaboration and partnerships are essential. Researchers, policymakers and practitioners must collaborate with each other, but also across sectors and with new partners.
So if you're interested in physical activity, in doing research in this space, in making policy in this space, or a practitioner, then you should join.
We know that being active is good for us. The World Health Organization's global report on physical activity is out now, and let me tell you, it's a bit of a wake-up call. Oh. Progress is too slow. It's uneven and unfair.
It's because of significant gaps in policy implementation.
Exactly. But let me show you what things could look like with a few changes. Look around. People are active everywhere. Keep moving, everyone. You're doing great. We hear about the benefits of physical activity all the time. We encourage walking and cycling for transport and fun. Look at these streets. They're designed for all people.
Whatever your speed or ability.
When we say physical activity keeps you healthy, we really mean it. Schools encourage physical activity every day, and it stays with us for life. Physical activity guidelines and targets are set to drive policy. That's a bit literal, but nice shot. So I know what you're probably wondering.
How can this become a reality?
Great question. Governments need to see the value in physical activity. They need to prioritize it, fund it, engage with local communities, and collaborate with partners. Invest in best practices to implement new policies. And use data to drive decisions. We need to come together to increase physical activity and improve our health, which can save us $27 billion every year. Enabling physical activity is an investment, and it pays off. This should be the reality everywhere. The choice is ours.
Welcome back. Now, after hearing about the key messages of the report, we are going to have a panel discussion with the distinguished panelists we have in the studio and how this can be related and used in our work to promote physical activity levels in our region. First, Mikkel Cicchini, Head of the Public Health in OECD. Mikkel, thank you for coming to Copenhagen to WHO office and joining us. And also I have Professor Zoltan Volko, who is the Epidemiology Director from the Center for Health Technology Assessment, Budapest. And also thank you, Francisco Ortego, Professor at the Faculty of Sports Science, University of Granada, for joining us in the studio. Mikkel, I will come to you first, actually. Please, I know you are the head of the OECD Health section, but tell us a bit about your work, how you do, and how this report will relate to make a difference in the work you do, and what are the key messages you find that will be useful to advance this agenda in the region.
Thanks a lot, Kremlin. Let me start by thanking you, your team, everyone at WHO for this very fruitful collaboration. It has been a pleasure working with you all and producing this joint report, which I think is very helpful for member countries. Now, if I have to think a single message out of this report that to me is really striking, is that we keep saying physical activity. In physical activity, any step count. That's what we found as well into this report. But every step count even double when we increase the amount of physical activity. There are two thresholds that WHO has on physical activity. The minimum amount, 150 minutes of physical activity, and then there is the second threshold on 300. Before us, some of the results were presented, and we saw the big advantages of meeting the minimum threshold of 150. 10,000 deaths, for example. This number of deaths become 3 times bigger if we get to the 300-minute threshold. And down the line, all the savings that are produced translate also in saving into healthcare expenditure, for example. OECD is an economic organization, and our objective is to produce better policies for better lives. With this report, we produce evidence that countries, policymakers at various levels can use to implement better policies. And we don't only make the economic case for it, but we also provide good example of how to implement it.
Thank you. We'll go to Professor Salton Walker. As you know, thinking about cost of any risk factor or disease is always a little bit difficult for a lot of public health colleagues and doctors to understand. And also when we have different numbers from different countries, it's always challenging for us to compare. So in your opinion, how do you see the methods we use in this report? How do you look at these methods in terms of explaining them and strengths or weaknesses? Please tell us, and also please tell us a bit about your work and how this can be related to the work you are doing. And thank you for coming to WHO for this launch.
Thank you, Kremlin, and thank you for the invitation. I think this is a great work, and from the perspective of a health economist also, and epidemiologist as well. My main research area is about the cost effectiveness of public health interventions and burden of diseases and risk factors. And in this respect, this is a very interesting report. And if I want to talk about the main advantages of the method used here is first of all the comparability, because as you said, from different countries, different methods, different models used, and in this case, it's very hard to compare these studies. And this used the same model and the cutting edge model, to be honest, to estimate the financial burden of physical inactivity. Why I say it's cutting edge? Because first of all, it models more than 20 diseases, many risk factors. And also it is capable, this economic model, to model complex interventions, so not just single interventions. And furthermore, what is a real novelty in this public health model is that it takes into account diseases which are not affected by physical activity. Because in a traditional analysis, people usually focus on the disease pathways which are directly affected by the risk factors. But if we extend life expectancy, for example, we need to be honest with ourselves that it opens room for other diseases which would otherwise not occur, which create healthcare expenditure as well. And there is an agreement between health economists that we don't deal with that. In a way, I may say we fool a little bit ourselves. But now this is an honest analysis because it takes into account this extra health and expenditure created by extending life and preventing other diseases. So it is a conservative estimate what's provided in this report regarding the healthcare burden of physical activity. And it is shown in the report that besides the health benefit, if we were able to meet the recommendation of WHO all over Europe, then what we would say on the healthcare cost. But it leads also to a little bit of reservation of myself towards the method, because it's communicated as saving this amount, although this is health expenditure of physical inactivity in a way, because we are not able to save this money. Because imagine we need to invest in interventions. So, and interventions are not 100% effective. So it is an illusion to find an intervention which costs no money and able to reach this target. So at the end of the day, we will not save this money. And then it leads to another area, which is the cost effectiveness of the potential interventions. And there are many interventions listed here, although their cost effectiveness was not really studied. There is a reference in it referring to a previous OECD work showing that a complex physical activity program could create return on investment. So really, it is a good investment from the economic perspective as well.
Thank you for that, your feedback and comments. Next, we'll go to Francisco Ortego. Professor Ortego, thank you for coming. Now, we hear the economic can help benefits of promoting physical activity. In your opinion, like of different policies and interventions, what do you think are the low-hanging fruits in order to get these benefits for our population sooner rather than later?
Yeah, well, thank you very much for the invitation. Pleasure to be here. Yeah, I'm happy to connect the report a little bit with the work we're doing in our research group, and yeah, we actually have when studying physical activity, we do have some challenges with how to measure it. So I think actually that when we look at this estimate of the burden of inactivity, is actually a conservative estimations, because the true association between physical activity and diseases is probably largely underestimated in the sense that it's very difficult to measure physical activity properly. So I would like to introduce another term that is physical fitness, that is also mentioned in the report, and is related with physical activity. Physical activity is a behavior, fitness is a condition of the people. But the difference is that physical fitness, we can measure it much more objectively and in a much more robust way. So when we look at fitness and burden of disease, our group has produced a very interesting studies looking at disability pension as an outcome. And this is what I want to bring to the discussion today, because disability pension is, on one way, is an indicator, health indicator, because people with a chronic, severe, and irreversible disease get a disability pension. So who has it has a severe disease. And also it's an economic outcome, because it costs a lot when people get this disability pension in the working age. So if we look at this fitness longitudinal study, we have conducted some with 1 million participants, follow it up for 35 years, and then realized that actually those with higher fitness levels, and we know that more active regions of Europe are also fitter, so there is an association between these terms. So higher fitness compared with lower fitness is associated with a much lower risk of having a disability pension from any different cause. So actually, I think that when looking at this report, we have to think that actually the estimates would be much larger if we will have actually the possibility to measure physical activity in a better way. But at least we have some other indicators closely related with physical activity, as it is fitness, that is telling us that by getting a population in a better fitness shape that comes with more physical activity promotion, actually we can get a lower risk of diseases that cost a lot of money to the society.
Thank you. There are 2 points, right? One is that this is a conservative estimate, because the true link between physical inactivity and disease is probably underestimated. And the other part is a fitness question. I'll come to that later. What do you think, Mikkel? Can we do anything to improve that, our understanding, to get more closer to realistic estimate? It's on one hand, it's better to be conservative so people don't complain that this is overestimated. But in order to get this true relationship from physical inactivity to diseases and to improve that, our confidence, what kind of data do we need from researchers or countries?
I think we already covered a lot of ground on this respect, but I agree with the other panel members and with you that there is even much more that we need to do. The data that we use to feed our model, and clearly the goodness of the result of the model largely relies on the goodness of the input data, needs to be improved. Yeah. We still struggle to capture information on, for example, the level of physical activity of the persons, the patterns of physical activity, how they spend their time, and how this translates into diseases. Then there is the other issue that, as was said before, we need to do better work to understand what is the cost of implementing certain policies. We have certain ideas for some policies more than others. I'm thinking, for example, intervention delivered by the primary care system. These are interventions that we can capture better in terms of their implementation cost. But other intervention, I'm thinking more about, for example, things that may have a significant impact on the level of physical activity, environmental changes. We all want nicer cities, nicer urban environment. Is this cost to be attributed to the impact that they produce on physical activity? Clearly, this is would be a very negative cost-effectiveness analysis because the cost of building bike pathways cannot be completely attributed to the level of physical activity they do. They improve the environment, they decrease the carbon footprint, they improve the traffic of the city. So we need to identify ways to better cost these interventions and to understand what's the share of this cost that should be attributed to changes in physical activity.
Do you have methods to compare the cost of implementation in different countries, taking into context the local cost?
Absolutely. That's something we are working a lot on, both in terms of healthcare costs. When a person develops a disease, may have different health pathways across the different countries. The provision of certain services may cost differently across countries, but also in terms of the type of policies implemented. We use standard systems that are largely based and developed in collaboration with colleagues at WHO in various areas, and we need also to work more, and I think it's our next step in this regard, to countries to try to better calibrate our estimates with some real example in a different area. But for example, now we are working to understand with France what is the cost of a policy implemented by France, and we are trying to match this cost with the one that we would calculate using our normal system to improve the system even more.
Thank you, Michael. So, Alden, we heard about the physical. Do you have a comment for that?
Yeah, I would jump on two topics if you don't mind, because my question is whether do we really need more precise estimates, because we are researchers, at least the two of us here at the table, but you have strong connections with research as well. But from a policy perspective, I mean, the evidence what we have now in our hand is far more than enough to act right now, because if the health benefit is somewhat larger, using stronger link between physical activity and diseases, if the healthcare cost is somewhat different, it would not change the need for action. And we know from research that there are cost-effective interventions to promote physical activity. So I wouldn't pretend that from an academic perspective we would focus on creating more and more evidence. No, I think it's time for action. And the other, which has just been raised, is the societal perspective. This report is mainly focusing the health and healthcare perspective of physical activity, but both the consequences of physical activity and the interventions goes far beyond the healthcare system, goes to other sectors, and the policies, think of urban planning, for example, or active transport. These are all outside the health domain, and then if we want to really estimate the cost and benefits, then if you think we need to work on that, then we need to use a so-called societal perspective in this analysis as well.
Yeah, thank you, Francisco. On that, the societal aspect of it, I mean, as public health, we always explain about the health benefit of that. How can we explain it to other sectors that there are benefits beyond just the health and the economic, but the other societal values, and also anything else you want to touch on the points we discussed?
Yeah, thank you. I agree that there is enough evidence actually for action, and that the estimates we have, as you say, a cost-effective €1 investment and bring back 1.7, so it's a 70%. But it would be good for interpretation, not to do, but just for interpretation to know that, for instance, one study that was published in 2019 with objective data on physical activity. So it was a pooling all cohort study that have used accelerometers to measure physical activity instead of questionnaire. It showed that the effect size on the risk reduction, it was dramatically increased versus the first report data. So what that means to us is that this, if already is good enough, the burden and the data and the economic saving, we just know actually, because there is scientific study proving that with better methods, this number would be even stronger. So we don't need to repeat the study. We have enough evidence, but it's good to know that it's actually even more than what we are seeing, actually. And this has been proved when comparing objective data versus self-report data on physical activity. So that's something actually that would be interesting. And also I would like to expand on the societal benefits that, of course, this report is very much based on disease burden oriented, but our group also has investigated on the effects of exercise interventions on getting people better far from the disease, and in which particularly we did one RCT called Active Brains that was focused on children with overweight obesity, and they did 5-month intervention with us, and they did aerobic and resistance training in line with the physical activity guidelines by WHO. And after 5 months of training, we observed a huge impact on intelligence, total intelligence, crystallized intelligence, total academic performance, particularly math and problem solving, and executive function, particularly cognitive flexibility. What this means is actually that we need to understand the data that the intervention studies, or RCT, randomized control trials, that we have usually are short-term interventions, either 5 months or 1 year, maximum 2 years, and there is almost nothing, only 1 perhaps, or 5 years. So we actually know that we can modify some of these factors from early in life, and that will produce a life trajectory different. So from a life trajectory, let's say getting fitter and healthier from childhood already versus inactive people who are not getting fitter. So in the end, the size of the difference as an impact for the society in getting better, cognitively better, have a better brain health, and reduce dementia and cognitive impairment in the future, that is a huge burden, is actually much more again than what we can see in the data. So I want just to stress that we have research studies pointing out that this even more need for this kind of physical activity promotion strategies, because they might change the life trajectory of people. And this kind of life trajectories, it come to big differences that is hardly seen because we don't have these so long-term interventions.
Soren, one of the things we see in our global status report in across regions, women do less activity compared to men. Lower education groups have lower physical activity levels. So how can this kind of a report help to reduce those gaps? And also, we know as we get older, physical activity levels are going down in all the age groups in our region. So these are areas that we are trying to improve. Otherwise, the same group can be doing more physical activity without improving on those lower groups.
Yeah, I think of course the report itself cannot do much, but raise awareness about this and makes the argument for investing in tailor-made programs also, because some of the interventions are largely on the population level, so policies not targeting special groups. But we know that there is a need for targeted intervention for different population groups with different risk profile and problems. And that also leads to another topic, that these programs are most effective if they are part of a complex public health intervention, because these people are not just suffering from lower socioeconomic status. It's not just being inactive, but there are problems with diet and smoking and so on. And targeting only one risk factors is usually not very effective. It's better to have, for example, a comprehensive program targeting minorities in my country, for example, the gypsy population. And there are these kind of programs, but not on the scale I would like to see.
Thank you. Mikkel, how do you think we can use the report to increase physical activity in those groups that we are struggling to increase or lower?
Well, I think Zoltan was right in the saying the report in itself provides the tools, right? It's up to policymaker and us, Kremlin, but also the colleagues at this table, to put pressure on the policymakers to make the changes that are badly needed to increase the level of physical activity in the population, both in the general population, but particularly in specific population group. I think that one of the beauties of this report is that it reports both logos of 2 leading organizations on the top of it. 2 leading organizations that are highly considered on the health side and also on the economic side. So this report doesn't speak only to the Ministry of Health, but it aims to speak also to who holds the piggy bank of the money that is needed to put this intervention. And as said at the beginning by the Director General of WHO Europe and how is written in the report, we know that the return on investment of policies on physical activity is 1.7 to 1. Every single euro invested in physical activity has a return on investment of 70%. There are very, very, very little investment that have such a high return on investment, and I think that across the government it should be seriously thought as a good investment. Now, we have some low-hanging fruit, I think, ahead of us. There is all the plans that countries are implementing, for example, on the resilience of our countries for future challenges. In many cases, there are also significant programs that are implemented, for example, in schools, in the workplace, in infrastructures. In many cases, with breaking silos and making these different groups work together, it can produce extra benefits that also touch physical activity, the level of physical activity of the population. A second beauty of this report, I think, is that it can be used not just by the government, policymakers at different level, from the central level to the local level, because physical activity is very importantly implemented also, policies to improve physical activity at the local level, by civil society. We have two representatives of academia, but also more in general, the civil society, non-government organization, to, with us, push on this point.
Yeah, thank you. And also, Francisco, do you think the other, not just the national governments, but the local authorities, local level actors, they are interested in this economic return, this argument? And can we use this as a tool to get them more active and implement to create this environment to be healthier and fitter?
Yeah, I want to believe so, that I'm in academia, in research, not so much in policy making, but I want to believe this is a strong argument for investing money and doing activities. There are some debates, for instance, locally in Andalusian government, where I'm from, the south of Spain, or in Spain, what about how many hours of physical education should be at the schools. And I think this is one of the things that or policies that can affect to the whole society, especially to the groups with the lowest socioeconomic status, because 100% of them are in the school. And other activities, it might depend on the interest of the family to participate in them. But this, if you change how many hours of physical education per week the children have, it's not only that you will ensure, like actually in some countries, in Hungary, I think. You have actually hour of physical education per day. So this will influence the whole population, as I was saying, and not only to increase the physical activity daily and weekly, but to increase the understanding of how to be physical active the rest of the day. So it's about the education on physical, so not only about what happened in the school, but what happened after the school. So I want to believe that by giving this strong economic argument, some of these debates that are at the moment hanging could maybe go to the good direction and make some of these changes that can influence the whole society, and particularly those who need it the most, that maybe some other policies don't reach them, and some of these years.
Thank you. I mean, you mentioned about the physical activity in schools and after-school clubs, and this is one of the best practices we have also documented in our fact sheets for EU countries. Especially in Poland, when these Ukrainian children families came, one of the policies that WHO and the National Institute of Sports in Poland implemented was expanding this after-school sports club to increase participation of Ukrainian children for health benefits, but as a way of integration, more integration. And that has been seen as one good example, which we are very happy. That also shows to the emergency response teams that physical activity sports club is also part of emergency response recovery phase, and not only the immediate surgical and other needs. So,
if you don't mind, it reminds me your note about the Hungarian mandatory PA class every day at school, which has recently been introduced now, I think, for more than 5 years. That it's not only an amount of time, but the quality matters a lot. Because it's also a challenge, because we had the old tradition of these PA classes focusing on fitness and jumping and running and not so much playing sports. But in my view, the key would be to make these kids like physical activity for the rest of their life. And indeed, not just being active with this compulsory 1 hour, but really being active the whole day and in their leisure time and so on. So there is a lot to do besides persuading politicians that we need this time devoted to physical activity in class. We need really good quality of these programs as well.
Yeah, so WHO has the Child Obesity Surveillance Initiative, which we call COSI. Out of the 27 EU countries, almost in 26 countries we have. And we look at the amount of physical activity they do during the school hours as part of the curriculum, but also across the day. And we see differences in countries, very significant differences between EU countries. Your point about physical fitness, do you think that most of the EU countries have this data about the population for different age groups, or is it only in few countries who are focusing on please tell us a little bit more about that.
Yeah, that's a really good question. I would like actually to have a fitness observatory as we have it for obesity or for some other markers, because it's relatively simple to measure. There are field-based measurements that are simple, can be implemented at the schools during physical education classes, and then this information can be actually integrated into the health systems. And there is a project, an EU-funded project that is called Feedback. And this project has tried to do two things. One is to create a platform, interactive and free access platform that all PE teachers nowadays, it was launched just a few months ago, can do the fitness test, introduce the results into the platform and get an individualized report on how the fitness level compared to European level. So it's helping monitoring and surveillance of fitness across Europe. But also in this feedback project, they have a 10-step approach of how to establish a fitness monitoring system at the national level. So I think there are a few countries, about 10 approx, that they are doing this already in Europe. And one of them is in Hungary, another is Portugal, another is Slovenia. Slovenia has been done for a long time. They're actually coordinating this project. And they put together their experience to help others, like Spain, who don't have yet. We have some regional, in Galicia, for example, but not the whole country. So help those countries that doesn't have the national surveillance system to tell them how to do it based on the experiences gained from this country that already did. So I think there is a way to go. I think improvement has been done, and it's now closer the possibility that one day we have more data on fitness across Europe, and that would be a very powerful, non-invasive biomarker of the health status of the different regions, because we know how powerful predictor of future health it is.
Our colleagues who are listening to this and from a country who doesn't have that kind of a program, what they should do if they want to establish or think about it, what should they do, who should they contact?
Yeah, they should go actually to a website, it's called Feedback, fit from fitness and back from feedback. So basically it's a play of words, and just in the website they go to the 10 steps to implement a fitness monitoring system. So I think there is a good start. And also Feedback Consortium is enlarging and is welcoming anybody who has interest in establishing this system in their country to contact the consortium to get advice and assistance on this process.
Thank you. Sultan, you talk about cost effectiveness of some of the intervention, and also not just focusing on physical activity, that we need to look at diet, tobacco, alcohol, it improve health. Do you think that we cost this intervention in a comparable way? Like when politicians have all these requests to work on tobacco, work on diet, work on physical activity, can they make some comparable estimates to see where they should invest?
It's difficult because usually the studies are segmented by risk factors, but there is one in the NCD framework, for example, identifying best buys of interventions, and there the method was the same basically, and gave comparison between the different risk factors targeting programs in low and middle income countries. And that showed, for example, that basically all established salt reduction programs are best buys, but also complex PA programs are also best buys. So there are some studies comparing and available for decision makers for this purpose.
Thank you for mentioning the WHO Best Buys, the most cost-effective intervention that's on the website, and you can find the different interventions for each risk factors or diseases. I think we have about few minutes left to wrap up this panel. So if I go from starting from Francisco, like your concluding remarks for this panel in about 1 minute, that will be great. This report, next steps, what we need to do, and how it can be used in your work as well.
Thank you. So yeah, we can say that the report is a big step forward. I think more government have now more reasons to implement, invest into physical activity and also promotion and also fitness monitoring and surveillance. And the evidence is showing that those who are fitter, those who are more active, it will actually have a lower risk of different diseases, also disability pension, and particularly on cardiovascular disease and psychiatric diseases that I didn't mention before, but these are the two main chronic disease outcomes that we saw more strongly related with fitness levels. So enough of reasons for action.
Thank you, Francisco, for your words. Sultan.
Thank you. I think this report is a great tool, and we need to use this nationally and internationally to create alliance to make physical activity and public health in general a priority for policymakers. Because the main barrier, of course, is to sustain political backup and long-term financing of these programs and going through the silos of the different sectors. So I think that requires alliance between the different stakeholders, but this can use for an argument to create such.
So this could be a tool to bring stakeholders together and create that dialogue. Mikhail Cecchini, as the person who led this project from the OECD side, and now it's published, what should be our next steps and what are your final remarks to the audience?
Absolutely. Let me start with the final remarks. Few years ago, in another joint output, WHO OECD, we defined physical activity the Cinderella of risk factors. I think with this report, we make a strong case on the fact that physical activity should not be the Cinderella of risk factor when it comes to tackling physical inactivity, and it deserves all the attention that it's important to give it. In terms of next step, this collaboration, as I said, has been great, I think, from many point of view with WHO. Certainly on OECD side, we look forward to next step to find synergies. I think that when the two organizations join forces is when we deliver the best to serve our member states. There are many areas, some of which are being mentioned this morning. We have talked about school-based intervention. I think we have not placed sufficient attention on intervention to promote physical activity in the more adult population. I'm thinking, for example, in the workplace, but we cannot speak for hours and hours today. There are others that will want to take the floor. The environment is another area in which I think there are great potential. There is great potential for synergies. Working at the intersection between environment and health, it is one of the greatest challenges that I think we have ahead, and is one area in which policymaking is advancing very quickly in certain areas, in others not enough quickly, and we would like to see a more quick advancement. But I think it's an area of great promise, of great interest.
Do you think finally that I know there are colleagues who are working on physical activity, promotion of physical activity, but beyond them, we have flagships on mental health, and we have a big focus in Europe at the moment on cancer. So we should make a call for these colleagues who are working on these diseases. If we want to prevent them, take a look at the report and look at the argument from physical activity from these disease sites as well. So the call comes from the others as well.
Absolutely. Physical activity is a very horizontal risk factor in a way that has many implications for many diseases, cancer, mental health, cardiovascular diseases. As much as possible, we should try not to work in silos. Clearly on the daily management, it's very difficult, but I think we should do this extra effort. And please, colleagues working on this area of work, look at the report, contact Kremlin and myself, and we'll be happy to help out.
Yeah, we can be sure that this not only talk about physical activity, there are diseases, links to other diseases, and you can find those numbers in the report. Thank you, Mikhail, for those words, and thank you, Zoltan. Thank you, Francisco, for being here and for this rich discussion. And we really hope all together, as you mentioned, this report will be a tool to bring academia, different agencies, OECD, WHO, others, Ministry of Health together. When we are back, I will be having colleagues who are working at city level, national level and regional level to think about their current experience and how this report can help their work.
We know that being active is good for us. The World Health Organization's global report on physical activity is out now, and let me tell you, it's a bit of a wake-up call. Progress is too slow. It's uneven and unfair.
It's because of significant gaps in policy implementation.
Exactly. But let me show you what things could look like with a few changes. Look around. People are active everywhere. Keep moving, everyone. You're doing great. We hear about the benefits of physical activity all the time. We encourage walking and cycling for transport and fun. Look at these streets. They're designed for all people.
Whatever your speed or ability.
When we say physical activity keeps you healthy, we really mean it. Schools encourage physical activity every day, and it stays with us for life. Physical activity guidelines and targets are set to drive policy. That's a bit literal, but nice shot. So I know what you're probably wondering.
How can this become a reality?
Great question. Governments need to see the value in physical activity. They need to prioritize it, fund it, engage with local communities, and collaborate with partners. Invest in best practices to implement new policies. And use data to drive decisions. We need to come together to increase physical activity and improve our health, which can save us $27 billion every year. Enabling physical activity is an investment, and it pays off. This should be the reality everywhere. The choice is ours.
We live in a world beating with urgency, breathing with difficulty, breaking under necessity. We are a society consumed by technology, compact in proximity, choked by inactivity. We are global, we are responsible, we are trending, we are too inactive. Everyone, everywhere, every day. We have a plan. It's time to activate our governments, to activate our environments, to activate our society, to activate ourselves. It's time to activate movement, to activate improvement, to reverse our direction, to activate new trends. We need to alert you. We need to activate. Everyone, everywhere, every day.
Welcome back to the final panel of this launch event. And now we are going to talk with colleagues who are working at city level, national level, and across Europe. What are the best examples they can see and how this report can be a boost to implement and increase those activities. Dennis Cahill, welcome. Dennis is the Healthy Cities Coordinator in Cork, Ireland, and we are going to talk with you about some of the examples from cities. We have Kasia Mikkelsen from Sweden, and she has been a long-term focal point for physical activity with all EU countries, but in a new role as the Secretary General of the Committee for the Promotion of Physical Activity Public Health. Thank you. Welcome, Kasia. And Andreas Paulsen, CEO of Europe Active. Welcome to all three of you to our studio in WHO Europe in Copenhagen. And Dennis, please tell us, thinking about these different programs cities are doing, what can be, if there are other cities who really want to promote physical activity and trying to understand where to start, what could be a good starting point, a groundbreaking intervention to take this agenda forward?
I think what this report has revealed, Kremlin, and what the discussions prior also show is that there's no silver bullet. There's no one simple answer to increasing physical activity. Multiple levels have to be addressed, and I suppose at the city level what we'd argue is that that's where action takes place. The policy is formulated at national level, the funding comes from national, and in Ireland, for example, our Department of Sport has funded active cities in Ireland, and in Cork we have active cities. The GAPA model is implemented.
Thank you. So I think, Dennis, the message there is there's no one silver bullet. Kaisa, if I come to you, the Eurobarometer data shows that nearly half of the adults, or 47%, do not do enough physical activity, but also those who do, majority of them do in parks, and the home settings are kind of secondary to that. So if there's no silver bullet, plus with these statistics, as a national committee, what do you think that, how can we use the report, and what are the starting points in terms of improving this?
Thank you, Kremlin. It's true that it's no silver bullet, and I think for being physical active you need to have a lot of different possibilities, and out of this parks and green spaces are really, really important, so you have to build possibilities close where the people are, so it makes easy and a low step to be active, even for the people who are not normally getting active, so you can put it in the daily life.
Can you tell us a little bit about your national committee? Why Sweden set it up? Do you see it in other countries, or what's the kind of rationale thinking behind it, and what you do for other listeners, other countries? This might be a good example to learn.
Yes, we are working in this committee appointed by the government 3 years ago, and we're just about to report our final report to the government. And the main aim is to see how we can increase the physical activity in Sweden, mainly with the public health as a goal. So we want to higher the lowest sort of level, so to get more people active and really to include the daily life. And to do this, we need to work on all different arenas and with multi-sectoral partners. So because physical activity, it's need to be increased by a lot of different agents, and it needs to be the traffic, the infrastructure, we need the school, we need the health care, etc. So it needs to be done everywhere. So what we're going to do is we both are working here and now with increasing sort of the system and strengthening the system, but we're also handling over a report to the government where they can, out of which they can make decisions, so they can change the system and hopefully improve it. So we have kind of a really good opportunity here, I would say.
Who are the members of the committee? Just as examples, that in your national committee, who do you invite, which sectors, and who's coordinating that?
Well, the committee is really an agency of its own. So we are 3 people working in full. But we're working with a lot of partners connected to the HEPA, for example, HEPA work. So it's from all different agencies, it's from civil society, it's from, well, we're trying to talk to everyone really to see what can be improved and what can we strengthen.
Thank you. And Paul, coming to you, and what do you think you try to improve it across Europe, working in countries? What are the main strategies you think is gaining more momentum, or successes, or particular policies that you see that, yes, this has good evidence, but struggling to take off? What are your observations across the region?
I think our industry have gone through a paradigm shift during the pandemic, and one of the key elements is moving from fitness as a focal point to holistic health. And I think one of the silver bullets that we have, speaking into there not being only one silver bullet, but one element that we know is critically important in terms of improving physical activity levels, is a more holistic approach to human health. So we need to speak into, in order to improve physical activity levels, we need to speak into physical, social and mental well-being. We need to normalize it being physically active. So we need to make sure that the market, civil society and government is working together. And I think there's been too much of a separation in that regard. We've seen political initiatives that are very singularly focused, but we need to have a holistic societal approach as well as a holistic human health approach. Some of the things that we're seeing in our industry is, for example, private-public collaboration partnerships taking place, where, for example, actors in our industry are working with local governments to develop public land in municipalities like GoFit in Spain, doing a fantastic job in terms of developing public land and making physical activity accessible to a lot of people, low-income groups, and so on. Much more holistic societal approach. We call it active citizenship. It's about our industry being socially responsible and socially aware in the communities we're part of.
Thank you. Dennis, coming back to you about the cities. The Eurobarometer report says lack of time and lack of motivation is a main challenge to achieve the recommended level of physical activity. What can cities do to address these determinants?
I think it's a very valid point, and I think if I was to think about my journey, even to this meeting here this morning here in Copenhagen, you know, how easy was it for me to get here from my hotel where I stayed to here this morning, and looking at the infrastructure that's here in terms of, you know, movement and movability around a city. I think cities can design themselves to be more accessible and to be more active. And that's an effort we've made certainly in Ireland and in Cork with the Active Cities approach, is to embrace that approach of not just messaging, not just data and facts, and these reports are very important, but also building environments that are conducive to physical activity. And as Andreas said, looking at public space, how are we making public space accessible to everybody, not just soccer pitches for middle-aged men or hockey pitches for children, that it's accessible to everybody, because sport isn't how everybody wants to participate in physical activity. Some people will do it in their day-to-day lives, and I think cities can and do play a massive role in that. Certainly when I visited the city of Pontevedra, it's one city in Europe that has really done immense work in terms of moving traffic out of the city. 90% of traffic now has gone out of the city centre, and what I witnessed was people walking to school with parents, older people very visible on the street and moving and active. The city is designed for movement, so I think cities play a key role in doing this.
Thank you.
Can I just mention something? When we talk about this, you need the cross-sectoral work, but you also need the work when it comes from government down to regional to local, up to regional and national and international level. So you need, it's many dimensions that you really have to take care of and to do anything that makes a difference. So it's not enough with just the national level, because then it doesn't maybe not help the regional and local level.
So the lack of time part I can understand. By design you can make it easy to work or something. The lack of motivation.
Motivation is always a difficult one, and I think it was discussed in the last session as well. I think what it's about is making activity fun, and making it what people want to do, making it the easier option, I suppose. So not just about mobility. Something we've done in Cork is utilising play as a way of making the city child-friendly, healthy, but also active. So play for activity, making spaces playful, colourful, attractive to families. So it's not just about children, it's about parents, it's about older people intergenerational. So what we've done is we embrace this approach. We didn't say we were closing the street to cars, we said we were opening it to play.
Yeah.
And we brought play to people where people traditionally hung out on a Sunday morning in an area of Cork City called the Marina. And people were naturally there, and suddenly they saw the potential of this space and the opportunities to be playful and active. Now, as a result of that small intervention for 4 Sundays in a month, that area has become permanently pedestrianised, because politically it was almost impossible to say this wasn't going to happen from now on. And then that gave a little bit of confidence at local authority level to try more pedestrianisation in the city centre. So what we can do is make it fun, make it accessible, but don't just make it about sport, or don't just think one person or one type of person. Think about everybody. How can we embrace this space in a way that everybody, as many as possible, can enjoy? And that's a place-making approach really to public space.
Thank you. Kajsa, now this motivation aspect, one thing is what we tend to do is tell the individual or get motivated, it's up to you. But we know that's not the right approach, that's not going to help us to achieve our targets. At the national level, what can we do, recognizing that's a challenge for everyone, and what can we do at national level to improve this?
I think it's important to get the understanding what the need is of being active, and you can't just tell someone to get active. You have to really work with it. It needs to be some kind of norm or some kind of system that for one example is whether you should bike to school, if it's dangerous or if it's good for you. I mean, maybe you can be hit by a car, which is no good, but on the other side you can also push that it's really good for the physical activity. So it needs how you put things in different directions, I think. And of course we can, through getting a whole society that makes it normal and easy and fun to move, it's easier that also other comes after and do the same. So
Andreas, I mean, our global status report shows in every country almost women have less activity levels than men. And also as we grow older, the activity levels go down in all the age groups, despite having good evidence why it's beneficial. So with the aging population, what do you think cities are doing, or what do you think is happening in order to accommodate the aging population, but also to address this need to increase activity levels in the older age groups?
I think it's something that our industry is directly speaking into. Again, there's been a big paradigm shift during the pandemic towards public health and a much more sort of diverse focus across different societal groups. One thing is that there's a big market potential in terms of seniors. A lot of seniors want to be active across Europe. We're definitely seeing that there's a big drive, but of course there's a socioeconomic factor as well that we need to address, that some seniors have less access to physical activity, and I think we need to tackle those barriers to physical activity. That's in terms of accessibility in many different regards. Tech can help us. The democratization, as we call it, of fitness, so basically more availability in the marketplace, creating more products at different price levels and so on, I think is a big part of the question. But I think touching a bit upon what was said before, it's very important that the government actors, local, regional, national government focuses on creating a framework that incentivizes physical activity and physical activity intervention in the market and in civil society. I don't think the government should be so focused on individual programs, but should create a great framework setting for great physical activity innovation. Civil society and market actors tend to be more in touch with consumer citizens and tend to be more innovative. And I think it's really important that we try to empower civil society and market actors as much as possible to tackle this problem by creating the right legislative policy framework.
How do you get those actors to work with the cities at city level?
Yeah, and I suppose that's the way that I work with the WHO Healthy Cities model. So Cork is a designated healthy city. There's almost 100 now in Europe, and the approach is about intersectoral action. And I suppose if there's anything I've learned in the 20 years that I've worked in health promotion, there is so much more to be gained from working in partnership than working individually. So We talked about multiple levels of benefit beyond just physical activity, that there's other elements of health. There's also other elements of society that can contribute. So if you're thinking at city level again about physical activity, your transport engineers are just as invested in active transport as you as a health professional would be. So combining your expertise can make things happen. So there is an openness to this approach. There's definitely more rhetoric around intersectoral collaboration. It can be challenging because you're coming to the table with people with very different perspectives. And my advice always is to go into that with a very open mind and not to be rigid and focused on just your objective, to be open to learning and to co-create, as the terminology says, in a way that's more beneficial, because certainly in my experience, intersectoral approaches are more hard-hitting and impact on the population much better.
So you find being part of the Healthy Cities Network as beneficial for you, and for any other cities who are not part of it, do you want to say a few words about it and what benefits you get?
Yeah, what we found with the Healthy Cities model and framework is we get designated by the World Health Organization as a healthy city because at city level and at policy level, we're committed to health. So we're thinking about health in all of the actions of our city, not just in the delivery of health service, which is actually the downstream side of health. So we're looking upstream and we're looking at prevention. And it's been a fantastic model in Cork. It's been very much embraced at political level, at policy level, and now it's very much embedded in our city development plan. So one of the key strategic objectives for Cork City is the development of our city as a healthy city. But it goes beyond just the policy then into action and intersectoral approaches. And because we have that model in place, we found that beneficial, for example, during the COVID response, that intersectoral response came naturally. But we also found when we brought the GAPA model around physical activity to Cork City, the structure was there to fit. So the Cork Sports Partnership, who lead out on the GAPA model, were able to align nicely with our structure and get that multi-agency approach. So it's been a fantastic model in terms of intersectoral collaboration, for sure.
Very happy to hear this intersectoral collaboration works at a city level. Kaisa, at national level, I know there are many challenges for colleagues to bring that intersectoral collaboration to work and to actually implement. What are the main challenges and what are the good points that you have learned in order to make it successful?
I can think that one of the good things that they've done in Sweden is really to put this committee in place, because we can take a step back and then we can look at the situation and then we can propose different needs of changes. And that's can be difficult to do by an agency who are a certain responsibility. We can now take a step back and then see. But of course it needs to be pointed out that no one owes the problem or the task. It needs to be owned by many different actors. So for the healthcare needs to understand what's in it for them to work with this, and the transport sector the same. So I think it's really to hire the understanding in what's in it for each part. And then I think it's one step on the way. But it's not easy.
Now, as we now move to the last concluding round on this panel, Andreas, I have two questions actually here. Like, where do you see a difference in across EU countries, the way cities are approaching to work with you and put the investment, and do you see any trends? Second part is, of course, as an industry, how do you said you want these social benefits of that, but also as an industry who's benefiting from advocating it, how do you keep that balance when you engage with policymakers?
I think a very important element, also touching upon what was said before, is of course evidencing the value of physical activity. And I think across sectors we are lacking that data. In our industry, we're building the European Data Hub, which is basically drawing on direct data sources from across all of our industry actors in order to really evidence how people are physically active in different countries and so on. And that we want to build into socioeconomic modeling with university partners across Europe to fully understand our wider social impact, right? I think data is critically important in terms of this, so that we understand as a society the value of physical activity. I think with regards to what we see across Europe, I think more and more doors are opening to dialogues about how we promote physical activity with the wider population. I think local and regional national governments across Europe are really looking to better, more creative, more innovative answers. And in that regard, again, I think the different market actors, civil society actors are the right answer, because they tend to be more dynamic, more innovative, more in touch with the needs of consumers and citizens. So I think we're meeting a lot of open doors, a lot of willingness to have these dialogues.
Yeah.
I think there's a little bit about the concept of sport, professional sports, that the terminology that we use, because a lot of citizens that potentially are not as physically active as it should be are put off by the traditional notion of sport, right? It's a classical issue, and we need, in that regard, to normalize physical activity and make it more accessible to different citizens.
Thank you, Andreas. Kaisa, in national level work, how are you trying to reach the lower education groups, lower socioeconomic groups through policies to make sure that their physical activity level will be increased, and how this report, finally, this is as the final round, how this report can help your efforts at national level?
This report really helps us with the arguments, because we need arguments for sort of politicians to take action. And it is, as you say, it's quite an open door in one way, because it's a lot of people and agents that think about that physical activity is good for you now. So it's really good with arguments, but still arguments is like a little start.
Yeah.
And then we need to really address all different kind of policies to address the people who are moving the least, because it's not one way to reach this group either. And I think it's also, when broadening the concept of sport, for example, it's maybe another kind of movement. It's really the daily movement that's most important, and to have the possibility to play in a playground or be in a park or whatever it is. So it's really to lower the possibilities, or higher the possibilities, maybe you should say. Yeah.
Thank you. Thank you for that. Dennis, finally, how can this report help your ongoing efforts in the city, Cork, but also disseminate to other regions to achieve your aims?
I think what the report does is validate the way that that we're working to a certain extent. It outlines the policy actions that need to take place, and definitely for us to act at local level, the policy needs to be in place. But I guess, as Cassia said, we can work from the local level to advocate up as well, and to feedback. And I think something we haven't mentioned yet, and something we should be mindful of, is the climate benefits of physical activity as well, and aligning with that climate agenda. I think that would be very beneficial, and is a way of levering national support for this.
Thank you, Dennis. And thank you to all three of you, to the panel, for this very interesting discussion. That concludes our launch event, the launch of this new report, WHO Europe and OECD report on Step Up investment to increase physical activity, because we see the burden of insufficient physical activity in our Europe for health, for economy, and for all other aspects of our society. I want to thank all the colleagues who joined us today, but specifically to OECD Deputy Secretary General and Head of Health for being with us, but also taking this journey for the last 2 years to develop this report, to produce this with the data, comparable estimates for all EU countries. We will be publishing few other country fact sheets very soon, non-EU countries in the WHO European region, using a similar methods which could be useful. Also, our acknowledgements to DG ARC, Sports Unit, for the collaboration for this project, and for all the member states for sharing their data, reviewing, and everyone else in the studio, and so those of you who are joining us online. Thank you very much. We hope you will enjoy the report and access it on the WHO Europe website and OECD website. Thank you very much, and goodbye from Copenhagen.